The second most common way of eliminating drugs from the body is through the liver, and it's called hepatic elimination of drugs. And it's not as common as kidneys. Kidneys are the major way that we clear drugs from the body, but it does exist, and for some drugs, it is definitely the way that most of the drug gets out of the body. So drugs typically move through passive diffusion um, from the blood into the hepatocyte, then into the sinusoids, where they are collected and secreted into the bile. Sometimes they're metabolized first and then secreted into the bile. Um, but in any event, they go through the bile duct and into the duodenum, into the small intestine. I am not advocating liver flush. I'm amazed at seeing things like this because the liver does the job all on its own. We do not need something to help it flush things out. Um, so anyway, um, some drugs are after they're eliminated. So here we have the hepatic artery. We go in. Some of our drugs are metabolized first, or they pass through unmetabolized via passive diffusion into the bile duct and then into the small intestine. And if they are lipophilic, or if some transformation occurs in the small intestine that makes them lipophilic, they may actually be back reabsorbed, remember, through the intestinal wall into the portal vein and back into the liver. And in this happening, some of that drug may go back out into the systemic circulation via the hepatic vein, and that will allow a drug, and then it'll come back again through the circulation, but it may have had an effect in the body, and it will simply increase the effectiveness of this drug. So a drug may seem to have a long, long time or long effect in the body, and it can do so via this effect. Now, some of the drug will be eliminated each time as it is put back into through the bile duct into the small intestine. But the effect of the whole reabsorption will be that it looks like it has a very long effect in the body. Things that will affect how a drug may be eliminated in this way is that if we have some liver disease going on, whether it's acute or a chronic degenerative process such as cirrhosis, this is a heavily cirrhotic liver, probably does not do much at all to affect um, uh, drugs leaving the body. Um, we would want to be careful if we have some kind of liver condition going on. We probably prefer to use a drug. If we need to use a drug for another situation, we'd want to use a drug that is eliminated by the kidneys. If we have to use a drug that's eliminated by the liver, we would want to use less of it because it's not going to be eliminated very fast through a damaged liver. Now we're going to talk about a concept called drug clearance. And drug clearance includes elimination of a drug through the liver, kidney, sweat, milk, any of those methods. That's what we're talking about when we're talking about drug clearance. Now, this concept, and we're going to use it to talk about the time it takes to clear a drug, we need to recognize that looking at our individual patient, if there is some compromise to the liver or kidney, that's going to affect this drug clearance that would have been calculated by a drug manufacturer. So how we express drug clearance is in terms of a half-life. The half-life is the time it takes to reduce the blood plasma concentration of a blood to half of its original concentration, of its high concentration. We use this to predict how often we need to give a drug. That's what the manufacturer has used to predict how frequently we must give the drug to maintain it in the therapeutic window for the animal. So this is a graphical representation of that. Here is our 100%, here's our high value of a drug, and if we then do not give it anymore, and we simply measure how quickly it is to eliminate that drug, the half-life, so here is 100%, here's 50%, so this is half the drug concentration. This is our T1 half, and it might be 1 hour or 2 hours. But we're going to just say this is T1, and then at the second half-life, so let's say this is 1 hour, in 2 hours, we're going to be down to 25% of that original 100% concentration. Then in another hour, we're going to be at 12.5%. So you can see this is a curve, and then it just gets to be take longer and longer to eliminate it each half-life. So our most dramatic reduction occurs in that first half-life, and then it's half of that and half of that and half of that until we eliminate the drug. So that's the half-life of the drug. So we use, and the drug manufacturers use that half-life to calculate steady state concentrations. And if you remember, we talked about steady state and we talked about this curve. So this is the multiples of the half-life. Each time we give a drug, it rises to a high concentration, and then here is our next time that we're giving it. So it hasn't completely been eliminated from the body. We're adding to it, and we're getting up to this point. And each time a portion is being eliminated, and once we add up to a certain point, we're going to reach a steady state. The steady state is at 5 half-lives. So this says approximately after 4 half-times, but it is 5 half-lives of when we're adding that to the beginning one, so it totals 5. It's a little confusing because I'm telling you 5 and it's showing 4 here, and I just want to be clear. But 5 half-lives is what we need in order to reach steady state concentration. So that's how the intervals between giving the drugs is determined by the manufacturer. So that steady state, if we look at these two examples, amoxicillin's half-life is 2 hours. If we multiply that by 5, then steady state is reached in 10 hours. So we can probably use about twice a day dosing on amoxicillin in order for us to stay in that steady state time frame. Phenobarbital, which is a drug I talked about before, using it for epileptic animals to keep them from having seizures. The half-life for that drug is 2 days. So steady state is not reached until 10 days. And we will use that time, we'll usually check an animal's phenobarbital level in 2 weeks because it takes at least 10 days for it to reach that steady state time to determine if we're in the therapeutic area for that particular drug. We also use that half-life for determining withdrawal times. The manufacturers will have a withdrawal time that they will determine for a particular drug, but we need to be very aware with an animal's state, their physiologic state, if they have either kidney or liver compromise, in looking at that withdrawal time. And sometimes we'll need to tell the owners to keep either the animal from going to market, keep milk from getting into their they'll combine milk into one big vat, and then from that vat the trucks come in and take the milk away, and so that milk should not be combined with the rest of the milk. It needs to go into a separate area. Typically they'll feed calves with that milk unless there's some reason not to do that, but the withdrawal time applies to eggs, to milk, to meat, and there will be specific withdrawal times for specific species for drugs, each drug, to make sure that we do not get the drug into the food chain. It's our responsibility as veterinary professionals to make owners aware that these drugs um, may be affected by what's going on in the animal and that it may take longer, and to be on the safe side, they should keep that animal or its products out of the food chain for a longer time.